of Kidney Patients. Hi, Bay Area Association of Kidney Patients, and everybody else who is on board, and welcome to the role of the nephrology social worker. My name is Vernon Silva. I am a dialysis social worker, and I have been working for 21 years in dialysis. And I'd like to introduce to you my co-presenter today, who is Michael Cervantes, and you have been working in nephrology and dialysis how many years?
48 years.
So together we're here to answer your questions, but also to provide you with some really interesting information that's only going to benefit you and help you in your dialysis center and everybody else that you know, okay? So first of all, let me go this way. Let me see if I can get us to the next slide. There we go. So, hi, everybody. Everybody is invited to join in. It is Professor Vernon's pop quiz on your dialysis social worker with special guest, Michael, Professor Michael. So you've got Professor Vernon and Professor Michael together. Because it's a pop quiz today, we're going to all be responsible for keeping our own score. Everybody, this is what I suggest. Take a piece of paper just like this, and when you answer a question and you get it right, write the number 1. If you didn't get the right answer, write a circle. So you're going to have a piece of paper, and eventually at the end of today's pop quiz, you will have something that will look like this. So we want a paper and pencil, and while you're getting that, I'm going to move on to the next slide, which is going to go over our goals, okay? Now, this slide is very, very, very busy. And I apologize for that, but it's the only slide that looks like this. All the rest of the slides are very user-friendly, but we want to make sure that it's very clear, especially when you come back and look at the recording, or for those who are new looking at the recording, that they understand exactly what the content is. So I kind of broke it down into these 5 categories. Number 1, what we're going to go over today is your transplant referral, evaluation process, active wait list maintenance. Okay, so it's going to be about referring the case to transplant. Okay, your community benefit linkage, like Social Security, state disability, Medicare, and Medicaid. Okay. Managing your input, including internal and external grievance and complaint processes, and the biannual patient experience survey. We're also going to go over your education and advocacy when it comes to patient rights and responsibilities. And of course, helping you with managing, let's see what I got here, your emotions and your perceived quality of life. Okay, does everybody have your pen, your paper and pencil, or are you just gonna remember how many you got right? Because we're gonna score it out at the end, okay? All right, let's get started. We're gonna try a real easy one, and you're not gonna mark it down on your paper. What you're gonna mark down is in the chat. Which one you chose, your answer. If it's right, you'll put down 1. If it's not, we'll put down the circle. Okay, so right now we're going to ask you a question and you are going to respond in the chat room. Here we go. Ready, everybody? Pop quiz. How many years of dialysis experience are there between us, between Professor Mike and Professor Vernon? How many years of dialysis experience are there between us? A is 20 years, B is 35 years, C is 50 years, and D is 70 years. Take a guess, or maybe you were paying attention when we were saying how many years we've been nephrology and dialysis social workers. Is it A, 20 years, B, 35 years, C, 50 years, or D, 70? And make sure that your chat does say to everyone, okay? Your chat should say to everyone. So we're getting in, we're getting in some answers here. Nice. Keep them coming. Let's see if there's any more. You can all see them in the chat. Okay, thank you. Good. Okay. Are we ready for our answer, everybody? Because here we go then. 70 years. So Michael, how many years have you been a dialysis social worker?
48 years.
And I've been a dialysis social worker 21 years. Now, this is our free one. Since this is our first answer, everybody gets credit for it. So you're going to mark down number 1. Okay, mark down 1. So far, all of us have gotten it right. That was a little bit of a bonus question. Okay, now let's get started. Are you ready, everybody? Here we go. How many college degrees is a dialysis social worker required to have? How many college degrees is a social worker required to have? A, 1 college degree. B, 2 college degrees. C, 5 college degrees. Or D, none of the above. Okay, write it into your chat. All right, keep them coming. Good. Good. Excellent. Any more? Great. Okay. 5, 4, 3, 2, 1. 2 college degrees. Okay. Now, I'll tell you where that comes from. I want you to understand that every single social worker who is in your dialysis center is required to have what is called an MSW. An MSW, and that stands for a Master's in Social Work. Okay. And in order to get a master's program, you have to have a bachelor's degree in something as well. Okay. So for example, I have a bachelor's degree in psychology and a master's degree in social work. Mike?
I have a BA in psychology as well.
And then your master's?
I have a master's in social work, but I also have another master's in education.
Which is just enhancing. It does not require. So as you can see, I have at least 2 college degrees. So does he. So what my point of this question is I want to make sure that everybody understands that your social worker does have a college education and a high degree. And so they are very capable of helping you and providing you any kind of support that you need. Okay. 2 college degrees. All right. Now, let's mark down. Did you get it right for number 2? If you did, write it, put a line. If you didn't, put a circle, and you're keeping track and you're keeping tally of your own answers. Okay. Next question. Here we go. Is the dialysis social worker required to have a state license to practice? Ready? Is the dialysis social worker required to have a state license to practice? A, no, since this isn't a mental health setting. No, Medicare exempts licensure. No, it isn't needed. Or yes, it's required. So we're going to do A, B, C, or D. Let's see what we got in there. All right. Very nice. All right. I think we've gotten all our answers. Good. We'll give you a few more minutes to answer and see what we've got. Okay. 5, 4, 3, 2, 1. And it is D. Yes, it is required. Now, required by who? Required by the Centers for Medicare and Medicaid Services, CMS, the Centers for Medicare and Medicaid Services. It's known as CMS. CMS is under the federal government, the Department of Health and Human Services. And periodically, the CMS, or what we just call Medicare, prints out a book of rules and regulations of how a Medicare certified dialysis center is supposed to be run, down to all the details. And that's going to include the dialysis social workers requirement. Those at Medicare who make these rules and regulations, which by the way are called the conditions for coverage, the ESRD conditions for coverage, which stands for end stage renal disease, conditions for coverage. Those who have created this document wanted to have for our dialysis patients the strongest, deepest history of social workers. So they wanted social workers who not only had a master's degree for you, but actually hold a state license. Okay, so you have learned from this that a state license is required. Now, we're mainly talking about California, and I want you to know that I know that some of you are joining us from other states, and perhaps the state may have a different requirement, but if you're talking about the federal government says you must have the highest level of either registration with your state board or the license, okay? All right, now tally it down. Did you get the answer right or did you not? So if you got it right, goes down 1. If not, put a circle. Okay, here we go for our next question. Are you ready? 1, 2, 3, 4, 5, here we go. Is the dialysis social worker recognized by the state as a licensed psychotherapist? Is the dialysis social worker recognized by the state? In other words, does the dialysis social worker, are they known as a state licensed psychotherapist? A, yes, as long as the license is accompanied by a marriage and family therapist degree. B, yes, but they do function as a clinical case manager. C, yes, and must contain at least 75 cases. Or D, no, that is a different distinction. Okay, so is the dialysis social worker recognized by the state as a licensed psychotherapist? Put your answers into chat and let's see what we get. Good. All right. Now I know we have like 1 or 2 social workers online, and the social workers, what do you answer? What was the social work answer? Even if you do it again. No, we already answered. Okay. All right. 5, 4, 3, 2, 1. Here's your answer. Yes, it's B. Is a dialysis social worker recognized by the state as a licensed psychotherapist? Yes, they are. But we typically function as a clinical case manager. Okay. Social workers are unique. Social workers are not only case managers, but they are also known as counselors. So when somebody has a state license, that means they're recognized as a psychotherapist, as somebody who can legally provide counseling. On top of being a counselor or a psychotherapist, a clinical case manager, B, means that we also help out with concrete needs as well. Okay, so let's talk a little bit about why you would need a psychotherapist. Okay, number 1, when somebody has a kidney condition that's long lasting, like we all have, okay, it often impacts almost every area of our life. Okay? It might impact your income and your job. If so, then there is the social worker who is there to help you with vocational rehabilitation. It might impact your transportation, driving, and so forth. Well, your social worker is there to help you resolve that problem and help you to resolve that issue. Okay. It might impact your vision. Okay. And if so, the social worker will be there to help to refer you out to community resources, because what case managers do is something called community resource linkage. Okay. Because our lives are so impacted by all of the time that we spend at dialysis, how we feel physically, how we feel mentally about it, sometimes we have some emotional repercussions. For example, I might feel down, I might feel overwhelmed, I might feel guilty if I'm not working or something like that. We have all kinds of different ways of reacting towards this very impactful condition that we all share. And so sometimes, in order to work out the emotional side of it, the emotional aspect, you can speak to your social worker and talk to the counselor or psychotherapist side of it. So what's really important for everybody on board to know is you have in your dialysis center a licensed psychotherapist. Okay. Now, that doesn't mean that every single patient is going to have a 50-minute counseling session every week. If you require that, perhaps the counselor will fit you into their schedule if they have time. If not, they will do the community resource linkage to something what we call community mental health services. Okay. However, these psychotherapists, these social workers who are in your that are in your dialysis center will utilize all of those clinical counseling skills, tools, techniques, and strategies to help you cope, to help you manage through. There may be some of you right now who are saying, yeah, I kind of had a rough week, this happened, and it would have really benefited me had I been able to speak to somebody, even if I just wanted somebody to listen to me. But these psychotherapists are there. These counselors are there. They're called your social worker. So you're welcome to talk to your social worker and know that they have a degree that includes clinical counseling, and that they have all of the skills, tools, okay, strategies, techniques to help you in a clinical fashion. And you need to take care of that, to take advantage of that in order for you to feel taken care of. Okay. All right. Did you tally up? Did you put on your tally whether you got the answer correct or not? It's time to go ahead. Put 1 if you got the answer right. Put a circle if not. We're going to move on to our next. Ready? Here we go. What is the ratio of dialysis social worker to patient? What is the ratio of dialysis social worker to patient? And what I mean by that is how many patients are on a social worker's caseload? So does your facility say, well, there should be 1 social worker for every 75 patients? Or there should be 1 social worker for every 100 patients? Or 1 social worker for every 120 patients? Or perhaps there really is no ratio. What do you think? Does the federal government, remember CMS or the Centers for Medicare and Medicaid Services, under the conditions for coverage, what is their requirement if they have one that says you need to have this many social workers to serve this many patients? What do you think? And put it into your chat, please. Interesting. Uh-huh. Good.
Yes.
Not sure if you get all that too. Any more votes coming in? Uh-huh. Right. Okay. Any more? We'll wait a moment for just a few more moments to see if we're getting any more votes. Five, 4, 3, 2, 1. There it is. It's D. There is no ratio. Okay, so the federal regulations in Medicare certified dialysis centers, which is there's probably 98% of all dialysis centers are certified by Medicare, which means that they are required to follow their regulations, do not have a ratio for social workers. Now, that's not to say that there's been a recommendation. Okay, obviously, the fewer patients per social worker, the more effective the interventions that the social worker is going to implement will be, correct? You know, if we had one-on-one, that would be perfect, all right? So the Council of Nephrology Social Workers, the Council of Nephrology Social Workers, which is the professional association of nephrology social workers like Professor Mike and Professor Vernon, has made a recommendation. It's not a requirement. And they have said the most effective ratio, the most effective caseload size for every MSW or licensed social worker in the counseling, in the dialysis clinic is a 75, okay? The recommendation has been for several years, 75 patients per social worker, okay? Now, let's move down to number C. I chose this number 120 patients because that's probably about the average. What do you say, Mike?
The average.
Okay, so we'd say about 120, probably the highest amount that somebody could be effective is maybe 135.
135, 140.
Okay, but there are some social workers who function in dialysis centers that maybe have 50 patients or even less. Okay. Well, that's true. So there are some that sometimes have the unfortunate, repeat that. Mike.
I'm sorry. And unfortunately, there are some clinics that may have a ratio as high as 150. Luckily, they're far and few.
Right. Now, we just don't accept that. You know, you all are proactive patients. You are proactive and you are preventative, because proactive plus preventative equals preemptive. That means if you act on it before the problem even exists, sometimes the problem doesn't even manifest. It's not even created. So if you find that your social worker is overwhelmed and is not providing the services that they're supposed to everybody, how many of you out there have said, what social worker? I never see him. I never see her. They never come around. I don't even know their name. Oh, yeah, I know who you're talking about. But I see them maybe once a month, every 2 months, every 3 months or something like that. Is that common? Sometimes it is. So as Trina's saying here, there's quite a shortage in social work applicants at this time. It's affecting the ratios in the clinics. That's true. But also a lot of our dialysis, international dialysis corporations set their own limits and their own ratio, because what they want is to get as the social worker as much work out of the social worker as possible. And unfortunately, it's at the patient's expense, which I'm sorry. So if you feel that your social worker is not somewhere that that's accessible to you or that's rare, then what you need to do is to submit a concern, an issue, a complaint, or even a grievance, okay? And you can talk to the facility administrator about it. You can call the local network office, and I'll explain what that is in a minute. You can call the state of California or whichever state you're in, meaning the Department of Health Services, and let them know that you don't feel that there is enough social services to provide you for your needs. Now, let me tell you something about complaints and grievances and concerns and so forth, okay? It is totally fine to complain or to submit an issue, because honestly, The regulations that I just told you have some rights and responsibilities written into them that say that the patient has the right to put in any kind of input that, and especially if it's negative, and never have to fear any kind of retaliation ever. It's against the law. It's against federal law. So I want you to feel comfortable. I know that people are intimidated to put in their grievances, to put in their complaints, and so forth. But I'm going to tell you, it's actually a very, very, very positive process, because it lets us all know that there's a shortage of staff, and they'll do something about it. It's called quality improvement. Mike.
And the other thing I was just going to say is that every dialysis unit does have what they call a suggestion box, and it's anonymous. And we have had patients, because besides being a clinical social worker, I'm also a supervisor, and we have had complaints in the box anonymously saying, we never see the social worker, or the social worker only comes around when they need either a survey complete or they need their annual assessment, whatever. And I just want to let the social workers know that in my professional career, we do look at whatever is put in the suggestion boxes. And I can tell you, there's been a couple of times where when people have complained that we don't see the social worker, it's not getting them in trouble, it's helping them, because when we do follow up, we realize, oh my God, this social worker just has too much on her or his plate. So we do look at those suggestions in those boxes.
And we look at them in a positive way. So please, our message to you is provide your feedback. And if it is saying that I'm not receiving the social services that I really feel like I need for my own case, then yes, I need to have, somebody needs to know about it, okay? Through a suggestion box, by calling the local network, which I'll tell you what that is in a minute, by calling the state, which is the Department of Health Services, and all of these telephone numbers are listed in the wait room. They're all listed in the lobby, okay? Feedback is great. It really helps the social workers who are also advocating for better ratios themselves, okay? All right, let's talk about what the network is. You ready? Okay. Let's say this. The United States and all of its territories are broken up into 18 different areas. And each of these areas has a network office. This office is run by an impartial agency that is contracted with Medicare, with CMS, to oversee the quality of care that each dialysis center in their area is providing. Okay, so in other words, the network and your Department of Health Services in the state work hand in hand to oversee the quality of care that's being provided to all of the patients, and will also act upon it. The network receives grievances, complaints, issues, concerns, problems, something even like this. The social worker hasn't come around to see me, and they will act on it. The network or the state will contact usually the facility administrator, or even make a site visit and come in and make sure that it's in place. It's doing them a favor. I think I just saw somebody in the chat say that it does us a favor, because sometimes the company itself will say, social worker, you need to cover 150 patients. But then if we get enough complaints from the patients that say we're not being seen, then the state will come in and say, you cannot be short-staffed, okay? And they will, and so the company will look at that and look at the recommendations, say we better hire another social worker, maybe you have somebody come in for a few hours from somewhere else and so forth, correct?
Yes.
Okay.
And I can tell you, I've been privileged that I work out of Network 18, and I have been privileged to have been on the board of directors and the medical advisory committee of the network. And whenever the network receives a complaint from a patient, no matter how minor, we,
Yes.
what the network does is that they contact about three of us that's on the medical advisory board, and we have to review every complaint, and then we have to submit our recommendations. And I can tell you that sometimes it could be as simple as, what happened to the ice machine? We no longer have an ice machine. And again, sometimes it's about, where they move me around, or that the clinic is too cold, or it's too hot, or there's not enough parking. So again, I just want to really encourage all the patients that are on this call to please utilize your network, and don't feel like you're snitching or you're going to get somebody in trouble. Sometimes it is a blessing in disguise, because I can tell you, I've been reported that, I never see workers, or I mean, never see patients, whatever. Well, then they investigated and they realized I was working for a major teaching hospital, and I had a caseload of 175 patients. So with the grievance, a complaint, whatever, my company, the hospital administration got me another social worker. So again, it's a blessing in disguise. Luckily, I do have credibility. So my upper management knew it wasn't because I was not working. It was too much for one person.
And so it was actually a favor.
It was a
that they
favor.
complained.
Yes.
Okay, so we're sorry that
I'm sorry.
we go on and on, but this is really important. So as you'll notice in the chat, for those of you in the Bay Area, it's www.esrdnetwork17.org. All the rest of you, you want to go to the National Coordinating Center. If you Google ESRD National Coordinating Center, you will find that. Okay, you'll find out what is yours, and it's usually this exact template. So, but they don't know what the number it is. Like, but Southern California is 18, and so forth. And so they'll give you a map and they'll tell you which is your network. But like I said before, you're also going to find this information pinned to the wall of your waiting area or the lobby. Okay. All right. So much about the ratio. Okay. You ready to move on to the next one? Here we go. Okay. Let me move this out of the way. What is this two-step questionnaire? What is this two-step questionnaire? Okay, Michael, I'm going to take the mic because I want to demonstrate something to all of you that is extremely important. Okay, so I'm the social worker and Michael is
The client, patient.
the patient. Okay, so Michael, I have two questions for you. Over the last 2 weeks, how often have you been bothered with little interest or pleasure in doing things? Not at all. Several days, more than half the days, nearly every day.
None.
Okay. Second question, Michael. Over the last 2 weeks, how often have you been bothered by feeling down, depressed, and hopeless? Not at all. Several days, more than half the days, nearly every day.
Several days.
Okay, great. Thank you for that. I wanted to demonstrate that to you. Okay, you ready, everybody? So, what is that two-step questionnaire that we just did? Is it A, the perfect icebreaker? Is it B, the annual quality of life survey? Is it C, the annual depression screener? Or is it D, the plan of care meeting invitation? What did you just witness me as social worker and dialysis patient do? The perfect icebreaker, the annual quality of life survey, the annual depression screener, or the plan of care meeting invitation? Okay, we're getting the votes in. Let's just see if there's any more. Good. Mhm.
Yes. Mhm.
Great.
Thank you.
Thank you. All right. Any more votes? 5, 4, 3, 2, 1. Here we go. It is the annual depression screener. Now, how long did that take us, Mike? A minute? Okay. That 1 minute can change so much of your quality of life or even save your life. Research has shown that this 2-step questionnaire, this depression screener, it's called the PHQ-2. PHQ-2 is a very accurate indicator of your emotions or your tendencies of your emotions to be towards low spirits or depression. Remember we were talking earlier and I was saying, this is a very impactful disease. It makes us look at a lot of, it affects and touches and colors a lot of our lives, a lot of the aspects of our lives. Well, a lot of times what occurs because of that, because we're so overwhelmed or we have so much going on, is we might experience low spirits. We might experience some depression. Now, some of it is even what we would call normal reactive, which means anybody in this set of circumstances would feel low spirits or depressed or lack hopefulness. It's true. Or it could indicate that actually there might be some sort of organic reason inside of us, an innate reason of why we're feeling depressed. Okay. So CMS, through the conditions for coverage, requires that every patient be administered a depression screening every single year so that the social worker can act upon it. Do community resource linkage. Okay. Did you want to say something?
Yes.
Go ahead.
And again, excuse me, some of the companies, it's not called a PSQ2, it's called a PSQ9. So there are 9 questions. And again, as Vernon said, every clinic is mandated to administer this. Many clinics, we do it not at the initial assessment, but at the 90-day, and then thereafter, every year minimal. But if the social worker feels there's something going on, we could administer the PSQ2 or 9 sooner than the yearly mandate.
Or more frequently, more often.
Yes,
okay.
thank you.
I'm going to correct you. PHQ2.
Oh, yes, I'm sorry.
Sorry.
PH. I'm sorry.
PHQ2. Sorry about that. So what we're saying is what you just witnessed was a very good screener. But there's even more detailed one that has 9 of those questions that I just asked Mike, which is the PHQ-9. And then I think there's also is it the CSD-10? Oh, but there are others that you're going to find out there that's going to help out. Okay. Right. Okay. So make sure that you are administered the depression screening at least once a year. It could really help you. Perhaps it would indicate that you would, you could, what's indicated in your life is counseling or taking a medication or something along those lines. Okay. It could really help you out, or maybe a referral to a support group. Okay. Or maybe a referral to, a telephone line where another patient answers who's on dialysis, and it's just somebody you can talk to, and it'll help relieve that pressure and not make you feel so low. Okay. So.
And this, please be honest, because I know that a lot of times patients feel like, oh my God, if I tell him I feel bad or I feel depressed, they're going to think I'm crazy. They're going, and no, it's just that, like Vernon said, most of our patients, and that's where we don't administer the initial 30-day assessment, because most patients do go through a period of depression. Your whole life is going to change now that you are on dialysis. But I just want to emphasize, please be honest, because your social workers, once they have built a good working relationship, they can tell. We really don't need to see this in writing, but we do, because it is a mandate and it helps us to really help the patients.
Because it does quantify it.
Yes.
It creates data. Okay, so it is important to take your PHQ too. Now let's go over to our answers. This is a perfect icebreaker. I saw that. Okay, there is another survey that is done annual, and it's called the Quality of Life Survey. There is, okay? And normally what is used is something called the KDQOL 36. KDQOL 36, and that stands for Kidney Disease Quality of Life 36, okay? Because it has 36 questions. It's like the PHQ-2 depression screener had 2 questions, and the PHQ-9 depression screener had 9 questions. Well, the KDQOL 36 has 36 questions, okay? And that is a measure of quality of life. And we're going to talk about that shortly. We just went over the annual depression screener and the plan of care meeting invitation. We will also go over that in a minute too. So it was C. Mark down on your answers. Did you get that right? Or put a circle if you didn't, and we're going to move on to the next question. Here we go. All right. Okay. Let me move this out of the way so I can read it to you. The dialysis social worker administers a quality of life survey because your perception of your quality of life affects which 2 things? The dialysis social worker administers a quality of life survey because your perceived quality of life, how you perceive your own quality of life, does affect 2 things that are very important that we're really looking for. What are they? A, nurses and technicians. B, fistulas and catheters. C, depression and anxiety. D, hospitalizations and survival. Which one of these 2 things is the KDQOL 36 measuring? Well, I'm sorry, not measuring, has results about. What do we got? Go ahead and vote. Good. Excellent. Excellent. Good. All right. Thank you for voting. Excellent. Okay. 5, 4, 3, 2, 1. It is D. Hospitalizations and survival. The KDQOL 36 will ask you several different questions in several different ways about your life, about how you feel about your own body image, how you feel about traveling. Okay? It even asks you about a sex life. It wants to know about all the different things that are impacted. Remember I said our lives are impacted in so many ways? Well, the KDQOL 36 asks very specific questions about all of those components of our life. And then the results come out to tell us whether you feel that your quality of life, you yourself, is high or low. It doesn't matter what your true quality of life is. What matters is what you perceive as your quality of life, okay? So if I perceive that my quality of life is high, chances are that I will be hospitalized or suffer from mortality, a death, are low. I'm sorry, wait, high, okay? No, are low, risk is low. Okay, let me try this again. If I perceive my quality of life as high, I will have less risk of hospitalization and a higher risk of living longer. Okay. Mhm. However, if my scores are low or they trend low, so in other words, I take it for 3 years in a row and I see that my scores are going down, 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 that means I have more of a risk for being hospitalized and more of a risk for not living as long. This is vitally important to all of you. Take your KDQOL 36 or whatever the quality of life survey is that's offered in your dialysis center so that you can find out the results and see if you are at risk of having to go to the hospital and of death. Okay, we don't want that. We want you to have a nice long life and avoid hospitalizations. Quality of life.
And the only thing I would like to add is we know that you can refuse to take this survey. But in my years of practice, very few have refused because again, it reaffirms how you see yourself. And we know that if people are trying to live the highest quality of life, they do well. And this is just like additional documentation. And a lot of my patients would take it home, would discuss the scores with their family and say, you know what, babe, you were right. You know, I thought I wasn't doing this well, but this validates what you've been telling me. You know, you are doing well. You know, minimize the negatives, emphasize
Maximize.
yes,
Maximize
the positives, you know. And so please, please, many of your patients, please do not just say, I have no time, I don't want to fill it out. Take the time. It really benefits you.
And you know what? You actually brought up a real good point. You said that some people refuse to take like even the depression screener or the quality of life survey. But the truth of the matter is, I am going to tell you this as your patient advocate, as a social worker, according to the conditions for coverage for Medicare, remember what we talked about earlier? You have the right to refuse any portion of your care ever. You actually do. And if there's ever any time that you would like to exercise that right, all you have to do is say so. You can refuse to take the surveys. You can refuse to have a medication done. You can even refuse to have the last hour of your dialysis treatment if that is what you want. We have to respect, just staff has to respect that right. Okay. So let's go back and see what we've got here. Nurses and technicians, nothing doesn't affect them. Neither does it affect the fistulas and catheters, such as the access. We already talked about depression and anxiety when we went through the depression screener. And then of course the hospitalizations and survival. So what you want to do is you want to make sure you take your KDQOL so that you understand if you're at high risk for hospitalization and not survival.
And I'm sorry, I also wanted to emphasize that even though, let's say, the social worker has a tracker and we have to give you the KDQOL, like say November, whatever. But if you have recently either gone through a loss or whatever, sometimes my patients will say, you know, Mike, this is not a real good time. I just found out that my daughter has cancer. So obviously your scores are going to be very low. So what I have asked them, and I've educated my management staff, you know, okay, so could I come back maybe in a month and give you this KDQOL? And they said yes. And my management people have been very supportive because again, it's the relationship you have with your patients and they're honest and you have to respect that. Thank you.
Right. So what you're saying, good. No, that's a good point, Mike. What Mike is saying is if you feel that your scores are going to be affected by something that's not normally happening, like something major happened in your life, and you can say, let me take it in a month when kind of my life renormalizes, you're more than welcome to. Okay, did you get that right or not? Mark it down so that we can keep score. Okay, here we go on to our next one. Okay, which kidney patient organization recently celebrated its 14th anniversary? Which kidney patient organization recently celebrated its 14th anniversary? Is it A, the Bay Area of Kidney Patients, Bay Area Association of Kidney Patients? Is it the American Association of Kidney Patients? Is it the Renal Support Network? Or is it the National Kidney Foundation? A, B, C, or D? Which one? Excellent. There you go. Everybody got it right. So everybody's pretty localized. It is the Bay Area Association of Kidney Patients. 14 years, going on 15. Congratulations. I believe I am a founding member. I think, yeah, I think
That's why you were out there.
That's right.
Yes.
And I think that I was a member when it very first started, thanks to Linda Youngbach. Thank you. Okay. Know that the Bay Area Association of Kidney Patients, as Deborah mentioned, offers so many benefits, and I'm sure you are very familiar with them. But also there are other patient organizations like the American Association of Kidney Patients, which is called the AAKP, the Renal Support Network, sometimes called RSN, and the National Kidney Foundation that also offers all their benefits as well. A lot of it is patient advocacy, patient education, and patient support. I know that both the Renal Support Network and the National Kidney Foundation actually offer peer support lines. So if you feel like you want to talk to somebody, you want someone to hear you, want someone to have a shoulder to cry on even, or someone to laugh with, you can have your social worker refer you to the Renal Support Network, the National Kidney Foundation, or come to a meeting of the American Association of Kidney Patients or a meeting of the Bay Area Association of Kidney Patients. They have online support groups every single month where everybody can share and kind of get it off their chest and have fellowship and feel supported. I just want to make sure that everybody realizes how important it is. You're a team. You are part of a team. You not only have created your own network, but you are also part of a team at the dialysis center. It's called the interdisciplinary team. We abbreviate it IDT. The interdisciplinary team consists of your kidney doctor, the nurse, the social worker, and the dietitian, sometimes a technician, or maybe another level of nursing, like say a clinical coordinator might be involved, and you are the most important, the most important member of that team, you and your loved ones. So it is important for you to always feel you are supported. You never take up this on alone. Look at all of these patient organized associations and organizations that you should be part of, that you need to reach out to. They have wonderful publications, wonderful meetings, newsletter, chat lines, support, online support groups. And so please take advantage of it. And congratulations to the Bay Area Association of Kidney Patients. I'm awfully proud of you all since I was there from the beginning and then moved to back to Southern California, and I haven't been as close. I'm so proud of you all, and I wish you the best of another 14 years. Okay, did you mark down whether you got the answer right or not?
Everybody.
Make sure you do. There it is. Oh, I didn't head up the answer, but there it is. Okay. So it's A, the Bay Area Association of Kidney Patients. Keep track. Okay, we're going to move on to our next question. Here we go. This. What is true about the kidney transplant evaluation process at the dialysis center? What is true about the kidney transplant evaluation process at the kidney center? A, the patient should consult their kidney doctor and have a discussion. B, the doctor, nurse, social worker, and dietitian all work on the transplant process. C, patient has the right to be referred to a transplant center regardless of what they're told. And D, all of the above. Let's vote. Good. All right, we're doing well. Good. Yes. Okay. 5, 4, 3, 2, 1. Votes are locked. Ready? There we go. It is D. It's all of the above. Excellent work, everybody. Excellent. Good class. Okay. let's break this down. Okay, the patient should consult their kidney doctor and have a discussion. Absolutely. The social worker will meet with you when you're first admitted. They'll meet with you 90 days later. They meet with you at least once a year, but they should be seeing you, like we mentioned earlier, frequently. And they're going to keep an eye on your case. So when you meet with your doctor, and we're going to ask what goes on with your doctor, I always ask this: have you had a discussion with your doctor about kidney transplant? And I encourage them to my patients to have a discussion with the kidney doctor, with our nephrologist. If the kidney doctor and you agree, or even if the kidney doctor doesn't agree, which is down here on number C, the patient has the right to be referred to a transplant center regardless of what anybody else thinks, because you do have the right. I, as your social worker, will refer your case to a transplant center, and it's to the transplant center that you prefer, as long as it's covered by the insurance that you have. So you have every right, it's part of the rights and responsibilities under the conditions for coverage, to be referred for a kidney transplant evaluation. Okay. This evaluation is a transplant center's way of determining whether you are a viable kidney transplant candidate or not. It is not up to the doctors. It is not up to the interdisciplinary team. It's not up to the social worker at your dialysis facility to say, no, it's not. Regardless of what everybody thinks, you are welcome. You have the right to be referred by the social worker, who usually doesn't. Perhaps in other facilities, it might fall onto somebody else, but it's usually your social worker, everybody. So consult your kidney doctor. It is true. The doctor, the nurse, the social worker, and the dietitian will all work on the transplant process. So say you went to the kidney transplant center and they said, your BMI is a little too high, so we determined that you are not a candidate at this point. But if you lower your BMI by a certain amount within a certain amount of time, you may qualify and can be re-referred. A BMI refers to your weight. You have to be within certain weight guidelines. So you can speak to the dietitian about what will help you to decrease your BMI or to lose some weight, let's say. You could speak to your social worker about the behavioral aspect about it, because social workers are counselors and psychotherapists, and they can teach you about how we feel about food and what we think about food, and how behaviorally we can address your diet or smoking or whatever is in the way. Yes. Your nurses will make sure that your medications that you're taking are also going to support that, and your doctor will encourage you as well. So we all have our different outlooks. We're all different disciplines, but we all are involved in your transplant process to do our best to get you to qualify. And you do have the right to be referred at any time for kidney transplant.
Yes, and years ago, there were transplant centers that had a cutoff age that you were no longer a candidate for transplant. Thank the Lord, that's no longer the case. No transplant center will state in writing that there's a certain age. Because as you know, there are many patients that are, like, say, in their 60s, their 70s, that live their life to the fullest, and they have a life of a 40-year-old. And yet we have patients who are younger, who really suffers from chronic severe depression, and they look at their life half empty rather than half full. And so the age is no longer a factor. So luckily, I'm blessed that all my doctors I work with will say, if a patient tells them they want to be referred, we will refer them. And then it's up to the transplant center to tell them, Mr. Silva, I'm sorry, but you're 80, and it would take another 10 years and you'd be 90. So again, that's the point I just wanted to emphasize.
Thank you. And you might have to be stand corrected a little bit on this one, Michael. As you can see, we're already getting in on the chat stating that there actually are limits.
Oh, they are.
And it is my understanding that there is, but it may perhaps in your area, you are, they will take anybody. So be careful, and you may be standing corrected.
Yeah.
So what it is every transplant center may have a age limit, where they will state that unless you can bring in a potential donor, we will not accept that referral. Okay, right. Yeah. Okay. So there can be an age limit, but thank you for that, because you were trying your best to make sure that everybody was informed. But that's what this is all about. We all are sharing information with one another and making sure that we are checking to make sure that we all are informed properly. So thank you for that. Okay, and thank you, Trina, as well, because you're absolutely right. And when I was listening to Mike, I was like, well, I'm going to make an edit to what you said.
And and again, I've been out of direct practice for a few years. I'm now only doing supervision, and every year we have asked at least the transplant centers in our area for their eligibilities and stuff. And in my area, a lot of the transplant centers will not put an age limit. But you're right, Trini, 70, whatever, because I just had a cousin on dialysis, believe it or not. He got a transplant at 69, and I was surprised.
Okay, see, even professors have to learn too. Thank you, Professor Michael. Okay, mark down whether you got this correct or you did not. That's going to be D. Okay, on to the next question. All right, here we go, everybody. How often are you supposed to attend a plan of care meeting? How often are you supposed to attend a plan of care meeting? A, you will be invited every 6 months to review your case. B, the first month of admission, and then every 6 months after that. C, the first month of admission, and then annually, unless your case is deemed unstable. Or D, the first month of admission, 90 days later, and then annually, unless your case may be deemed unstable. So everybody, what is the schedule of you being invited to what we call plan of care meetings? A, B, C, or D? Mm-hmm. Right. Mm-hmm. Okay. Ready for the answer? Here we go. And there it is. Everybody got it right? It's D. The first month of admission, 90 days later, and then annually, unless your case may be deemed unstable. A plan of care meeting follows an assessment by every member of the interdisciplinary team. So the first month that you're at dialysis, the fourth month that you're at dialysis, and then every year after that, unless something very significant happens to your case, each member of the interdisciplinary team is going to interview you and conduct what is called an assessment, where they gather information and then collaborate with you on an action plan moving forward. That action plan will then be discussed together either by telephone, conference call, or you all gather in a room together with COVID precautions, or perhaps chairside. But everybody should attend. A patient plan of care meeting will involve all of the interdisciplinary team members and the patient, along with any loved ones, and you will all collaborate and communicate with one another on the action plan going forward. The dietitian may say, according to the labs, we may need for you to take an extra phosphate binder. The social worker action plan might be, I'm going to go ahead and refer your case to a kidney support line for discussion and support. Okay, and then we all decide if it's all okay together. Everybody, this is extremely important. Extremely important. You are the most important member of your interdisciplinary team, of your team. Please participate. Like we said before, you have every right to refuse, but in this case, you should be receiving an invitation. You will receive an invitation. Usually it's the same month that your interdisciplinary team members are holding their assessments, and they will let you know that it's being held and give you an option as to which way to do it: phone, in person, or chairside, and if you'd like to come or not, because some people would prefer not to, or okay, do it by phone, whatever you'd like. Okay, plan of care meetings. Okay, everybody indicate whether you got that correct or if you didn't. You ready to move on? Okay, here we go. Next question. To express dissatisfaction with care or mention a concern, an issue, a problem, complaint, or grievance, A, can be downright intimidating. B, is one of your rights per the federal regulations. C, is right up the dialysis social worker's alley. D, all of the above. What do you think? What do you think, everybody? I wasn't sure if these are the votes from the last question or this one. Oh, here we go. Okay. There we are.
Yeah.
Okay. Okay, everybody. So the answer is, you ready? Is D. It's all of the above. Now, we already went over a lot of this before, but I want to make sure that you understand the terminology: concern, issue, problem, complaint, or grievance. Any of those is actually counterintuitively helpful to you. So, but it can be intimidating, because if we complain about the people who have our lives in their hands, we might feel like they get mad at us, or they want to retaliate. It is against the law. And the staff is in service periodically to be reminded of so. We look at all input in the most positive way. It is one of your rights per the federal regulations. I told you about that and how you can express your input to the state, to the network. Sometimes our corporations themselves have a patient line that you can call in and speak to somebody who's in administration. That's always helps too. And all of the above. Now, I have something on my phone that I had a note, Professor Mike, that I wanted to read. Okay, here we go. Social workers listen, advocate, and take action. For example, we don't resolve the complaints. We don't, but we drive the resolution. So if you have a question about that, so I want you to understand that as patient advocates, we are there to just make sure that your voice is heard, and that the staff who is responsible for solving the problems, like the facility administrator, the clinical coordinator, the regional director or area manager, they are responsible for actually giving the solution, coming up with the solution with you. The social workers are responsible for writing them and making sure that they are doing their job and getting back to you. For certain grievances and complaints, you're going to receive an acknowledgement letter. And it's going to thank you for your input, regardless of how negative it may appear. It's not. So we thank you for that. And then most all will receive a resolution letter, which states, hello, on a certain time, at a certain date, you express this input. We want to let you know that here's what we've done about it. Let us know if this is okay. The social worker is usually responsible for having those letters facilitated. But the social worker themselves, in order to avoid a conflict of interest or a dual relationship, will not be the exact problem solver. Do you agree with me? Yes. Okay, good. All right. Any comment, any question on that? All right. Okay. But it's true. It's intimidating, but it is what needs to be done. Okay, here we go. Twice a year, I am contacted in order to fill out a patient satisfaction survey. We're talking about the patient. Twice a year, I am contacted in order to fill out a patient satisfaction survey. Is it A, it's actually a patient experience survey that the social worker could help me with, or B, it's actually a patient experience survey that the social worker cannot help me with? What do you think it is? And so every year you're contacted by somebody. Sometimes it's by phone, sometimes it's by mail. What is that? It is a patient experience survey. Can the social worker help you with it or cannot help you with it? Great. Okay, so twice a year, a third-party impartial vendor required by Medicare must contact all patients with a few exceptions, maybe new patients, okay, who are accepted or are exempt, okay, to take a patient experience survey that's rather extensive, but it is so worth it. It's feedback that is anonymous, confidential, private. And this information, data is organized and presented to your dialysis center for all of your administrative members to contemplate and do something about. It may say that, hey, we're doing a great job, but if it does state that they're not, it will tell you which areas of improvement are required. So let's review that. There is an annual depression screening. There is an annual quality of life survey. And there is twice a year patient experience survey that we ask that you complete. All of your input is so important. On top of all of that, I want you all to know, because this is our last question, is I want all of you to know that it is important for you to be involved in your center. Did you know that patients are now supposed to be attending the dialysis facilities quality meetings? Now, most of these quality meetings are held every month. They don't necessarily have to be, but they normally are. That's the standard, the community standard. We call them QAPI, QAPI for short, quality assessment, performance improvement. And we should have patient representation there to help the administration to improve the quality of care that you are experiencing there. And the network, remember we mentioned there's 18 areas, and the network oversees the quality of care as well. They too are requiring each facility to have what's called a peer mentor. A peer mentor who is going to provide directly from patient to patient education and support from the network. So become involved, be involved as the patient. Okay. All right. So here we go. It's B. The social worker cannot help you with that because it is impartial. Okay. Okay, go ahead.
And again, a lot of times patients will bring the survey and say, I don't speak English. I need help. Well, I know in my area, it is available in Spanish. I'm not sure if it is available in
other languages.
Yeah, I don't know if it's available in other languages, but never expect the social worker to help you fill this questionnaire out.
And it's not because of retaliation,
No,
Professor Mike,
no.
or all of the class. It is because we want to make sure that you feel comfortable answering any way that you want to. I mean, suppose you did have an issue with the social worker, like we had discussed earlier. We want to make sure you feel comfortable expressing it. Okay, did you tally up all of your scores? How many scores did you get right? Don't write them in the chat. Don't write them in the chat. Okay, ready? Here we go. If you got all 12 right, 100%, look at your score. If you got 11 right, 10 right, 9 right, 8, or 7. Okay. If you're up here, that is wonderful. It means you're a very informed, proactive patient. If you start to get 8 and 7, that's okay. That's average. Probably some room for improvement, but hopefully we help to educate you. And then anything under, even more so. Become a proactive patient, be involved. It is your care. It is your life. Social workers are here to help you. Like I just said, we're your advocate. We can be your counselor. We are your clinical case manager.
Before the questions, Professor Silva,
Yes.
I think we had a very outstanding class, very intelligent, and I was very, very impressed. And thank you for letting me be a guest participant.
Thank you, Professor.
I'd like to thank both of you. That was very informative and fun to do. So
Okay.
thank you very, very much.
Absolutely.
I have
So,
questions. If you'll put them in the question and answer box. I see that we've got 2 questions so far. The first one is, it would be wonderful if CKD patients not on dialysis had access to social workers and their services.
oh my goodness. So the question states is, it would be nice if CKD patients could have access to social workers and social services. Okay. All right. So how do we do this?
Are they saying that
Be pre dialysis. I do know that Medicare, I believe if you do have Medicare already, they will cover a consultation with a social worker. But here, okay, I know the answer now. Took a moment for Professor Vernon, because I myself consider myself a member of the community regardless. I serve everybody. And if somebody has a question about dialysis or any kind of need, whether they're a kidney patient or not, I will accept the task because I'm a social worker. This is him too, but not every other social worker may do that. But I would do this, and this is what I've done in the past. Look up your most near dialysis center, call and ask for the social worker, ask for the help of what you need. Do you need education materials? Do you need referral to the Bay Area Association of Kidney Patients, or any patient organization to, what is it that you need? And let them direct you. They will do what is called community resource linkage, and they will provide you. So you need to identify, my answer is identify a point person, which is normally your dialysis social worker. They, like Mike and myself, will help you directly or guide you to who does.
Great to know.
Okay, one moment.
Really wonderful to know.
Again, I don't know the Bay Area because I've never worked there, but I know in my area, we have a fair amount of patients who have Kaiser. And Kaiser does have, before ever they start dialysis, they do have counseling social workers available before a patient gets to CK5.
Right.
Yeah. Their availability for social workers start at 3, 4. And again, as Vernon said, and I have a little different twist, but I'm blessed because I work for a corporation that we only have 12 clinics in Southern California. So I'm very blessed as a social work supervisor. I have access to the medical office of all the nephrologists that work in our clinics. So they know that if a patient pre-dialysis have any questions, they can refer to me because I usually don't do direct practice. I do only supervision. So I do share my cell number, my personal cell number, and my email. And so again, patients, I think if there's questions, I've tried to answer. And like Professor Silva has said, I refer a lot to the patient organizations that have a lot of education material prior to dialysis. And also some of the networks that I've been privileged to work with, they have a lot. And So anyway, that's it.
That is it.
That's
And
great.
that is good. So the social worker at your nearby dialysis facility, the ESRD network, the patient organization, but please be careful about what you look for online. Okay, go to the National Kidney Foundation or the American Association of Kidney Patients, BAAKP.org, and so forth to get the correct, accurate information.
Also in the chat box, Trina wrote that there are some programs being started for this.
Correct.
And Wayne said that John Muir has a health advocacy program with social worker case manager support.
Yes.
I realized that John Muir's in my area.
And more those who are experiencing CKD are getting more and more support. Okay, it's coming down in legislation. Okay, what's the second question?
The second question is, I feel that referring to end-stage renal disease is depressing to patients. It's a poor choice of words.
For end-stage renal disease?
Yes.
Isn't it though? Somebody would make the comment that the term end-stage renal disease is depressing, and it is. And we all have been advocating as social workers to change the vernacular on that. I know that they now, instead of calling them, say, dialysis centers, they'll say kidney centers or end-stage kidney disease, but even the end stage itself is negative.
Yeah.
So we are working on that, but Michael.
And I can tell you,
be aware of it.
because I am the grandfather of dialysis. In 1973, the term was end-stage renal disease. And you guys are absolutely right. It was very depressing because my patients were saying, you know, Mike, you're telling me that I have my life ahead, whatever. End stage means I'm at the end. It's like when you get diagnosed with cancer, end stage terminal cancer. Why am I going to make plans for next year? I won't be around. So luckily, the new lingo is stage 5.
Or chronic.
Yeah, chronic kidney disease, stage 5. But as Professor Silva has said, it is taking time to get rid of the ESRD.
So we apologize for that, even though we didn't create it, but
Yeah.
we as social workers are advocating for that.
And then another question is, some of the nephrologists give wrong info about eligibility for transplants. They've told patients they have to go on dialysis first.
That is that's true, that is misinformation. They're saying that nephrologists have told patients that they actually have to go on dialysis first before they're even eligible for a kidney transplant.
That's not true.
That is not true. So
No.
again, what you can do is contact your local transplant center, and get a hold of the social worker there. Every dialysis center has a social worker. So does every transplant center. It is required by the same law that and I would contact that social worker or even the transplant coordinator or anybody there at the transplant center and self-refer. You can self-refer.
And again, I'm fairly strong about this point because I just had a patient start dialysis and he's already been on a transplant list for a full year. So again, that's misinformation. I'm sorry.
How do you recommend finding a good nephrologist?
How do I recommend finding a good nephrologist? Right now, I would go to my primary care physician, my regular doctor, and be referred out. Is what I would do. What about yourself?
Yes, I agree with Professor Silva, but also as patients, if you go to the nephrologist that your primary has referred you to, and for whatever reason, it's not a good fit, you either recontact your primary and said, Dr. Cervantes and I, we're not going to get along. Do you have another nephrologist you can refer? Because most primaries do have more than one nephrologist, unless you're with Kaiser or a managed healthcare plan that you have only certain nephrologists you can go to.
You're right. I agree. So, try your primary care physician. And normally when you are with your primary care physician, they're going to refer you to somebody who's in network or somebody that they know and associate with, and they're already formulating your team at that point.
Personally, I would also recommend support groups because, people talk about their doctors and a lot of times how much they love their doctor. And that's a good way to find names and then see if they're in your plan, of course. Does anybody have any other questions? I'll give you just a second. This has been absolutely so informative and interesting and fun. So I really thank you both for presenting today and teaching to us. And I've learned a lot, and I'm sure all of our participants, except for the existing social worker, has learned a lot because she got all the answers right.
Absolutely.
Thank you, Vernon, Michael.
And thank you all, because it's the first time that we have done our class format this way, and you guys just made it a wonderful experience. Thank you so much. Thank you, all of you.
Thank you to all of our attendees also. Everybody's thanking you in the chat too.
Thank you.
And thank you to all of our attendees. Our next support group will be in October, and our next webinar will be in January, and it will be on home dialysis. So we don't have the date scheduled yet, but we do know what our next webinar topic will be. So thank you, everyone. We appreciate your joining us today. Bye.